hysterectomy is one of the most common surgical procedures performed on women in the United States. In fact, it ranks second only to cesarean sections, which rank number 1. A hysterectomy is usually performed by your OB/GYN or a qualified surgeon trained to perform this procedure. In a hysterectomy, your uterus is removed. However, sometimes other organs are removed as well, and it depends on the cause of why you need to have the surgery to begin with. So for example, a hysterectomy may be performed if you have certain cancers such as uterine cancer, ovarian cancer, cervical cancer. It's also commonly used to treat chronic endometriosis or chronic pelvic pain, pelvic inflammatory disease, fibroids, uterine prolapse, unmanageable infection, or uncontrollable bleeding. Now let's take a look at what types of hysterectomies are out there. There are partial hysterectomies and total hysterectomies. Now, in a partial hysterectomy, only your uterus is removed. However, if there is reason to remove other organs, your OB/GYN may perform a total hysterectomy. In a total hysterectomy, you may have your cervix removed along with your uterus, as well as you may have your ovaries and even surrounding tissues, including your fallopian tubes and even muscle around those organs removed. It really depends on what has caused the reason for the hysterectomy. So if you have, say, chronic endometriosis, your surgeon may actually remove your uterus, cervix, ovaries, fallopian tubes, and some of the tissue in your pelvis in order to get rid of that endometrial tissue that is causing you trouble. It's also important to note that when you have a hysterectomy that removes your ovaries, it can induce menopause, early menopause, or it's called surgically induced menopause. So if your ovaries are removed, you will no longer have estrogen and progesterone produced. Therefore, you will have all of the symptoms of menopause, you'll no longer have periods, and you will need to deal with some of the symptoms associated with low estrogen and low progesterone. Let's look at what surgically induced menopause looks like, as well as what recovery from hysterectomy looks like for women. Your recovery from hysterectomy depends largely on why you had the surgery to begin with and how the surgery was performed. So there are many different ways in which a hysterectomy is performed. Your surgeon may use the traditional abdominal hysterectomy, which is where they make a single incision in your abdomen and work through there in order to remove the necessary organs. However, surgery has modernized, and that is not the most common method used today. Most physicians use laparoscopic technology. Using laparoscopic technology allows a surgeon to work through a smaller incision, or actually a couple small incisions in your abdomen, and to use a camera to guide their moves inside your abdomen. Sometimes they also go through your vagina and also use the camera through your abdomen as well. So there's a couple different routes in which they can access those organs. Now, most women may stay in the hospital a couple of nights to recover and make sure there's no infection, no bleeding, and no complications from anesthesia. Most women also return to normal daily activities 3 to 4 weeks after the surgery. However, now that you are fully recovered, you probably are in menopause if you had your ovaries removed, and you certainly no longer have periods if you had your uterus removed, which is the goal of hysterectomy. So things are a little different, and it can be an emotional journey for some women. So make sure to be prepared for that and open up with your close friends and relatives to make sure that they're supporting you during this time. If you did have your ovaries removed and menopause is new to you, you're going to have probably some new symptoms that you're not familiar with, and it's perfectly normal. Your doctor will guide you in what to expect and how to manage those symptoms. If you're looking for further community on how to survive menopause though, join us in our Peri community. There are plenty of women that have had hysterectomy and have had surgically induced menopause that can help you get through this time. Thanks so much for joining me today on the Peri channel.